Welcome to the Youth Layperson Trauma Training course. We're here today to teach you some techniques that will help you save a life if you come across someone who's had a traumatic injury. What do I mean by trauma? This is any kind of physical injury to the body, like a car accident, a broken bone, falling, a dog bite, a gunshot wound, maybe if a limb is amputated, anything like that. And these are some steps that are going to help you save a life before you bring them to the hospital. Trauma is something that happens all around the world, and it's something that you might come across. We're going to teach you some steps called the ABCs. And the reason why we teach you this systematic approach to trauma victims is because we want to take care of whatever is going to kill the patient first. And we've modified it for a low resource setting. So in any instance where you don't have equipment available to you that you normally would have when it's taught for ATLS. So the most essential things you'll need are plastic bags, a stick, or it could be a fork or a pen, something around this size, and a big cloth. It doesn't matter the material. And those are the materials you'll need in order to rapidly stabilize a patient before you take them to the hospital. To start the scene management section, this is a time to act out someone being injured and being found laying on the road. Melina's down on the ground. What are you going to do? So you come across Melina down in the street. What are you going to do? What is going to be your first step? All great answers. The first thing you want to do in any sort of trauma emergency is make sure the scene is safe. You don't want to become another patient, and so you always need to keep your safety first and foremost in your mind so that you are okay to take care of the patient. What do I mean by scene safety? Well, let's say you're on a busy highway and there are cars going back and forth. Is the scene safe? What if Melina was bit by a dog and that angry dog is still there? Is the scene safe? What if she was hurt by someone with a knife or a gun and that person is still there? Is the scene safe? Those are the kind of things you want to keep in your mind as you approach the patient. The next thing that you want to do is you want to identify two people in the crowd. Usually when there's any kind of traumatic injury, there tends to be a lot of people around. Use that to your advantage. Point to one person and say, I need you to get a taxi or a truck or some form of transportation to get this patient to the hospital. You point to the second person and say, I need you to get me a big cloth of some sort of material, a stick or a fork or a pen, something along these lines, and either gloves, or since those are hard to come by sometimes, plastic bags, chip bags, anything to cover your hands with that's plastic. Now you have someone taking care of transportation and another person taking care of the materials that you need most. You need to think about your personal safety. Any person who's been in a traumatic incident, sometimes they can spray bodily fluids like vomit, spit, or blood, and you want to protect yourself from that. So you want to protect your nose and your mouth either by getting a scarf or bringing your shirt up over your nose and your mouth. You can protect your eyes by, if you have glasses or if you have sunglasses, you can put those on. And then the next important step are protecting your hands, especially from blood. So you want to look for plastic bags if you can't find them, if you can't find gloves. And if you have gloves, you want to put those on. So now I'm safe. Now I'm finally going to approach the patient. In any kind of emergency, you always want to introduce yourself. You always want to explain your actions before you do them. And you always want to remain calm. So when approaching the patient, you introduce yourself. Hi, my name is Isa. I'm here to help. Are you okay? Now that first question is important for a lot of different reasons. But one of the things it's important for is it's assessing her mental status. And what I mean by that is how well her brain is functioning. If Melina is able to respond to me in a way that makes sense, that helps me know that her brain is working properly. But if she does not respond to me in a way that makes sense, are you okay? She either doesn't respond or, are you okay?
Twinkle, twinkle, little star.
If she responds in a way that doesn't make sense at all, then I'm worried that her brain is not working properly. And that's what we call an altered mental status. If she does respond, are you okay?
No, I'm hurt very badly.
And it makes sense. I know her brain is working properly, and I would label her as alert and awake for her mental status. Bring up a volunteer to demonstrate scene management. If they have trouble, have them ask the class for help. Now we're going to teach you the 3 most critical steps in dealing with any kind of trauma victim. These are the A, B, C's of trauma. A for airway. B for breathing. And C for circulation. And the reason why these are so important are these are 3 things that can kill any patient very quickly, but there are steps you can take to prevent this. It's also important to know it's not something that you just go A, B, C one time through and you're done with. Patients can get sicker and change, so always have the ABCs in the back of your mind and constantly be reassessing the patient to make sure that these haven't changed and they're still stable and in a good position as far as these things are concerned. Sometimes you also might not be able to get all the way through the ABCs. You might be stuck at B for breathing because you can't move on to the next step until the first one is good and stable. And this will make more sense as we go through. Now that you've established that your scene is safe, you've sent one person for transport and another person for the materials that you need, you have on your personal protection, you want to go through the ABCs, starting with A for airway. When you first go up to the patient and you ask, "Are you okay?"
No, I'm in a lot of pain.
And she's able to talk to you, not only does that help me assess how her brain is functioning, it also helps me assess how her airway is. And what I mean by that is the tube that goes from your mouth to your lungs to carry air. If Melina can talk, I know that airway is open, and that's important because if it's closed, that can kill you. But if Melina can't talk, "Are you okay?" I can't make sure that her airway is open. So what I need to do is with my gloved hands, I'll open her mouth and I'll check to see if there's any spit or blood or vomit, because a lot of times when patients have an altered mental status and their brain isn't working, any kind of blood or vomit can build up in their mouth and nose and block the airway. If I see anything, I'm going to take 2 fingers and gently scoop it out. Sometimes you might also see that the tongue has rolled backwards. Gently pull the tongue forward. And that's one way of making sure that you keep the airway open. Next, if Melina was able to talk and I know the airway is okay, or after I've checked to make sure I've removed anything from the airway, you'll move on to B for breathing. Now is the time to bring up a volunteer to demonstrate airway. Now that we've gone through A for airway, we're going to go to B for, that's right, breathing. And when we go for B for breathing, we're going to look, listen, and feel to make sure that Melina is breathing. One easy way to know that she's breathing is if she can talk. So again, we go back to that important question, are you okay? That helps me know how her brain is functioning, if her airway is open, and also if she's breathing. Because if she's talking, then she's breathing. But if she can't talk, then I really need to look, listen, and feel. So I can look to see if her chest rises and falls. I can listen by putting my ear up against her chest to hear for breath sounds. And I can feel by putting my hand by her nose and mouth to feel for her exhale. Or I can even put my hand on her chest to see if I feel the rise and fall. If Melina is not breathing, or if she's having difficulty breathing with an altered mental status, you are going to do a move called the jaw thrust. But before I show you how to do the jaw thrust, what do I mean by difficulty breathing? This would be if Melina was making funny sounds, if she was breathing way too fast, like she had just run up a mountain and back, or if she's breathing really, really slow, like I could barely tell. That would be difficulty breathing. But it's important to know it's difficulty breathing with an altered mental status. If Melina can talk to me and her answers make sense, she probably is going to be in a position where she can breathe the easiest. I'm going to leave her in that position. We call that the position of comfort. But if Melina doesn't make sense when she's talking to me and she's having difficulty breathing, or if she's not breathing at all, I'm going to do the jaw thrust. So I'm going to come kneel by her head. You can stabilize your elbows either on the floor or on your knees. What you're going to do is feel up behind the ear along the jawbone. And if you feel on yourself, you'll feel the back of the jawbone right here. You can kind of hook your fingers underneath it, and then you'll feel it curve down along. You don't want your hands on the underside because then you're just going to be closing the mouth. You want to be with your palms facing forward with two fingers hooking behind that part right beneath the ear and pushing forward so you give the patient an underbite like this. So it would look like this. I'm going to come over here and I'm going to push forward. Now with this, my thumbs are free. If her mouth is closed, I can open her mouth to further open up the airway. The jaw thrust is important because it keeps the airway open and it also pushes the tongue forward. If you are here holding jaw thrust, you are stuck here holding jaw thrust until someone else can take over who has higher training because you are keeping that airway open. You will stay at this step. It also takes a lot of finger strength. When you're practicing on yourself or on a partner, you're going to be gentle because you don't want to hurt them. But in real life, you need to push forcefully and it takes a lot of finger strength. So just keep that in mind that it's going to be hard work sometimes. After you've checked to make sure that Melina is breathing, you also want to check for two other injuries that can kill a patient very quickly that are related to breathing. The first one is a sucking chest wound. And this is when there's a hole in the chest wall that sucks air in. So normally you breathe through your nose and your mouth and that air goes into your lungs. In this case, the air is going into the chest and skipping the mouth. So if you see this, what you want to do is you want to put what we call an occlusive dressing. So this is anything that air can't go through. So a normal cloth bandage wouldn't work because if you pull your shirt up, you can breathe through the cloth in your shirt. So you want to pick something that air can't go through, like a glove or a plastic bag or a chip bag or even the plastic liner on a cigarette. That you'll place over the sucking chest wound in order to prevent the air from going through. The other wound is a flail chest. And what I mean by that is when two parts of a rib are broken, so like here and here, and it becomes a piece that moves out of sync with the rest of the chest wall. So when you breathe, your chest wall normally goes up and down at the same time. In a flail chest, there's going to be a segment that moves opposite to what normally happens. So look closely at the chest wall to make sure that it's not going up and down at the same time. If you see that, take a heavy bandage like a small bag of rice or a folded up towel and place that on the flail chest to splint it. And that's B for breathing. Now is the time to bring up a volunteer to demonstrate breathing. Make sure students can recognize signs of difficulty breathing and they can have the correct hand placement for jaw thrust.
Alright, we've reviewed airway and breathing, so now on to C for circulation. So the big question with circulation is this patient bleeding to death? So the first thing I'm going to do when I approach this patient after assessing airway and breathing is I'm going to look for big bleeding. Now, what's the very most important thing to do before you look for bleeding and before you actually handle a patient who's bleeding? The answer to that is you want to make sure you're protected. So we've talked about this already, but we can't stress it enough. So if you have glasses, protect your eyes, protect your hands with either gloves or plastic bags, and if possible, you can protect your mouth to prevent any blood from getting in your mouth. So now I'm going to approach Isa, who's had a stab wound. Isa, my name is Lucy. Are you okay?
No! Malia just stabbed me and I'm bleeding everywhere. I'm so scared.
Alright, so first things first, Isa's talking, airway and breathing are okay. Now I'm looking for bleeding. Now this is pretty obvious. She's spewing blood out of her arm in this situation. But if you can't see the bleeding, the first thing you can do is actually use your hands and do a sweep to see if there's blood present. So if this were a patient down on the ground after a car accident, I might come, run my hands behind her back, and actually look for bleeding. If you find bleeding, you're going to want to identify the source and address it. So now the big question is this a big bleed? So you can have either an arterial bleed or a venous bleed. Now an arterial bleed you can identify because it's a squirting bleed. So every time the heart pumps, blood is squirting out of the arm. An arterial bleed is a dangerous bleed and something that we want to address right away. Now venous bleeds, which you can have just oozing of blood, can also be very dangerous, and you're going to want to identify big bleeding there too. Now once we identify a big bleed, the first thing we're going to do is apply direct pressure. Now I want you to take your 3 fingers and I want you to apply the tips of your fingers directly over the bleed. And then you're going to take your thumb and wrap it around the other side of the limb. Now you may need to wiggle around it a little bit to find that sweet spot or the spot that's going to hit that bleed. Then what you'll do is you're going to apply some pretty firm pressure for 10 minutes. And the really important thing here is no peeking. And I know it's tempting, don't do it. What we want to do here is we want to push on that bleeding vessel and encourage that vessel to spasm down. And once that vessel clamps down, you're going to stop the bleed and save a life. Now, once I've held pressure for 10 minutes, I'm going to remove my fingers and see if the bleeding has stopped. In this scenario, we're going to pretend that Isa's bleeding has stopped. So the next step is to apply a pressure bandage. So do you remember when we got that person to bring us that cloth? Well, here's when we use it. So what you're going to do is take your cloth and rip it so that you have a piece that's about the width of your hand. And this can be 2 or 3 meters long, whatever you can find. Now what you're going to do is you're going to start wrapping from distal to proximal, or from the finger side up towards the part of the body that's closest to the heart. And the idea here is a way to remember this. We want to pull the blood up towards the heart. So I'm going to start here just below her cut, and I'm going to wrap up. And I'm applying pretty firm pressure here, but the main thing is you don't want to cut off the circulation to the fingers. So if at any point Isa tells you that her fingers are numb or tingly, or you notice that there is any color change in the fingers, that means your bandage is too tight. Once you've finished wrapping the arm, you can use another piece of cloth or a rope or a string to just keep that bandage secure. Now the important thing here is you don't just want to leave Issa, and you don't want to forget about this bleed. She could start re-bleeding at any time. So you're going to keep a close eye on it. And if you notice that she's starting to soak her bandage, you're going to want to take that bandage off and try direct pressure again and try to control that bleed. Alright, so now let's talk about a difficult scenario. Let's say you're approaching a patient with such a massive bleed that direct pressure just doesn't make a dent. This could be a patient with a huge wound, or this could be a patient who maybe is missing an entire limb and is bleeding out of that limb. So in this case, we're going to have to resort to some drastic measures, and we're going to have to use something called a tourniquet. Now, back to that cloth, and now introducing that stick that our friend brought us, we're going to show you how to make a tourniquet. So first thing you're going to do is you're going to rip a piece of cloth that is about 3 fingers in width. Just like this. And this can be about 2-3 meters long, whatever you've got. The next thing you're going to do is figure out where you can apply the tourniquet. Now there are 4 places you can place a tourniquet. And this is anywhere in the body with a single long bone. So that would be the upper arm or the upper leg. The reason why it only works where you have a single long bone is because the way that the tourniquet works is it squeezes all those vessels up against the bone and stops the bleeding, creating a dam. Now if you have 2 bones, like you have here in the lower leg and the lower arm, when you apply that tourniquet, blood can still run between those bones, and that tourniquet is not going to work. So first thing you're going to do is take your 3-finger width bandage, and you're going to apply it to the upper leg or the upper arm proximal to the bleed. Now you want to hold a little bit of a loose end, just a couple centimeters so you can tie, and you're going to keep your hand about 4 or 5 centimeters away from the arm, and you're going to wrap. Now once you get to the end, you're going to tie. Okay? And then the next thing you're going to do is take that stick, and you want to place the stick between your arm and the bandage. So in between the bandage and the arm, just like this. Next thing you do is you're going to hold that stick or that pencil or that fork, whatever you can find that's in this shape, and you're going to twist. And I'm going to twist this really tight in real life. And what you want to do is see the bleeding stop or get that bleeding as close to stopped as you possibly can. Now, the thing about a tourniquet is a tourniquet is your absolute last resort. And that's because when we stop this blood flow from Issa's heart to her arm, we're going to be cutting off all nutrients and oxygen to this particular limb. And so over time, this can be really dangerous. So once you've placed this tourniquet, you don't just want to walk away. You're going to want to continue to monitor that. And so every 20 minutes or so, you're going to untwist the tourniquet, and you're going to see if the bleeding has stopped. If the bleeding has stopped, take the tourniquet off. If the bleeding hasn't stopped, retighten the tourniquet, but continue to watch it. Now you want to make sure this patient is on their way to the hospital. So you've called a taxi, you've talked to the neighbors, some plan is in place to get her to the hospital as soon as possible. Now this is really important. If you've had a tourniquet on for greater than 6 hours, that means for greater than 6 hours, this patient hasn't gotten any oxygen to this limb, then you want to leave that tourniquet on. And that's because after 6 hours of no oxygen, this arm has died. And if we allow blood flow to return to the arm, that blood is going to flow through the arm and pick up all of the toxic materials that have accumulated in this arm and bring it back into the body, and it can make the patient very sick. So we're going to leave the tourniquet on until that patient gets to the hospital, and they're the ones who will treat them.
Now is the time to demonstrate C for circulation. You can have a volunteer come to demonstrate these skills, or you can ask the entire class. Make sure that people demonstrate direct pressure and are applying enough force. Also have students demonstrate how to apply a tourniquet.
We have just discussed the most important parts of our course, scene management and the ABCs, airway, breathing, and circulation. If you've gone through those steps and your patient is in stable condition, this means that their airway is open, their breathing is not compromised, and you've controlled their bleeding, then you may move on to this next step that we call the secondary survey or head-to-toe survey. This next step is the secondary survey. It's also called the head-to-toe survey because when you're at this step, your job is to examine the patient from head all the way to their toes looking for any other injuries that you haven't assessed in the ABCs. When you're doing this part of the program, it's very important in a real situation to expose the patient. That means removing any clothing. You do this so that you can examine them quickly and accurately. When you do head-to-toe survey, you start at the head, you expose and palpate. That means you're very, very thorough about looking for any injury. And you will do this throughout the body. So you'll start at the head, move to the shoulders, and downwards. Now stop. You've just gone through the ABCs and you've noticed that your patient can't protect their airway. That means that their mental status might be altered and that they have either blood, spit, or vomit coming out of their mouth. In this situation, you want to roll your patient into something called recovery position. This position allows them to drain whatever is in their mouth out and get them ready for transport. When you roll a patient into recovery position, you need two people, someone to help you. The person at the head, and that will be me, is in control of the situation, and the person at the side helps you roll them. So when you do recovery position, you need to determine which side you want to roll the patient. In this case, we'll roll the patient towards Issa's side. So the first thing you want to do is raise their leg so that their knee is up on the side that you want to roll them. The second thing that you want to do is you want to take the patient's arms and bring them up over their head and squeeze them very tightly, ensuring that the head and neck are straight. This is very important because it helps protect their cervical spine and protects them from spinal cord injury as you're rolling. So, Issa will place her hands at the patient's chest and hips for rolling. The person at the head counts 1, 2, 3, and after this count, we will roll the patient. 1, 2, 3. Finally, what you do is you take the patient's arm and you will set it on their side to help stabilize the patient. This is what recovery position should look like. If you notice, the patient's arm is at their side to stabilize them, the bent leg is propped down, and then the leg on top is stacked over. This prevents the patient from rolling over. You can now transport them safely to the hospital.
Now's the time to ask for 2 volunteers to demonstrate the log roll. Make sure that they move in sync and that they protect the C-spine while doing it.
Now, as you go along the secondary survey, you may encounter burn wounds. Let's imagine in this scenario that Lucy has a burn wound on her arm. If her arm is still on fire, please put the fire out. We recommend smothering the fire with a thick cloth or using water if it's available. Next, you want to make sure that the affected area has no clothing or jewelry near it. So I'm going to remove Lucy's jewelry, and if she had a sleeve, I would remove the sleeve. The reason we do this is because burn wounds swell and can cause loss of circulation if you have clothing or jewelry on that affected limb. Next, you want to make sure that you avoid putting any creams or ointments on the affected area. The reason we do so is because burn wounds compromise the integrity of the skin and can expose it to great risk of infection. You want to find a clean, dry bandage, and this is the most important thing, is to make sure that it is clean and dry, and you apply the bandage much like a pressure bandage, starting from the distal end and moving towards the heart. secure your bandage by whatever means you have available. And then take your patient to the hospital for further evaluation of her burn wound. Along your secondary survey, one of the most common injuries you might see is a broken arm or broken leg. And one of the ways you can tell this is if you're moving the patient's arm or leg passively, there might be a lot of pain, or you might even see bones sticking out of the skin. So when you're assessing a patient for a broken arm or broken leg, the first thing you want to do is put them in the correct position for splinting. If they have a broken arm, it's important that the arms are in a comfortable position close to the patient's chest. For broken legs, it's very important to keep both legs straight and close together. This decreases the chance that there might be bleeding inside. When you're splinting a broken arm or broken leg, it's important to gather your splinting materials. You'll need some thick padding to protect the joints from pressure. You'll need splinting materials, and commonly, you may be able to find cardboard. If you can't find cardboard, it's okay to use any material that is hard and firm and approximately the length of the limb. So you can use magazines, sticks, water bottles, whatever you can find. And lastly, you'll need a cloth that you'll use to hold the arm in a sling. So let's imagine again that Lucy has a broken arm. The first thing we want to do is place her arm in that position of comfort close to her chest, like so. Next, you want to assess for bleeding. If you see bleeding, you'll want to manage it in the ways that we've discussed earlier, while also being careful not to further injure the arm. Before you apply the hard splinting material, it's important to use padding to protect the joints. And in this case, I mean the elbow. So I'll place the thick padding material close to her arm and making sure that it covers her elbow. Thank you, Lucy. Next, I bring my splinting materials. It's important to splint above and below the joint. This will help with preventing the arm from moving. So I'll start with this. And that covers below the joint. And next, I have my next piece of material, and I'll place it above the joint. Now you need to secure the splint, and we'll do this just with some cloth that I'm going to tie around the splint. And you can use any material that you might find, ropes, string, cloth, whatever. You want to make sure that it's very secure. So I'm actually going to use another piece of cloth. Another principle of splinting is you want to make sure that the fingers and toes are left exposed and can move. Lucy, can you wiggle your fingers? Yeah, perfect. The reason you do this is you want to make sure that you're not cutting off circulation to the hands or feet. Next, you want to apply something that we call a triangle bandage, and that just means some piece of cloth or fabric that will keep the arm in a sling. In this case, we have a sweatshirt, and so that's what I'll use. You want to apply the cloth, first covering the shoulder of the affected arm, and then bringing it under so that it can support the arm. And then you want to tie at the opposite shoulder. Making sure that it's very secure. So if the patient can still move their arm, you'll want to make sure that you secure it with a piece of fabric or rope or string, whatever you can find. And what you'll do is you'll place the fabric around the patient's affected arm and tie it across their chest, leaving their other arm free for movement. And that's how you might treat a broken arm.
Now's the time to ask for 2 volunteers to demonstrate splinting. Make sure they position the bone in the correct position, and also make sure that they don't forget to pad around the joint.
In this scenario, Lucy has an object sticking out of her arm. We call this a penetrating object. So the last thing you want to do is pull out that object, because what can happen is if it's lodged in an artery or a vein, it can start bleeding a lot, and we don't want that to happen. So the most important thing you need to do actually is support the object and make sure that it doesn't move. So what we'll do is we'll take a thick cloth or something that you can use to pad around the object, and we'll do exactly that. So as you can see here, I've wrapped it around the object to make sure it has a better chance of not moving. And then I'll use a bandage to wrap around the cloth and around the penetrating object to make sure that it doesn't move. You want to make sure that it's really tight and secure. And of course, after you've secured it, you want to make sure that you take your patient to the hospital as quickly as possible. Congratulations, you've reached the end of the course. You've stabilized your patient. You've gone through scene management, the ABCs, and secondary survey. Now it's time to take your patient to the hospital. So in order to do this, you need to be able to transport them. One way to do this is to make a simple stretcher. For this, you need the large piece of cloth that your friend got you, as well as 2 strong sticks or poles. When you lay out your sheet or your piece of cloth, you want to make sure that you take your 2 poles and place them on the cloth such as to divide them into 3 parts. 1, 2, 3. Next, you'll fold over the cloth to cover the sticks. This is your stretcher. You're now ready to transport your patient on the stretcher. Before you do anything, make sure that you protect their head and neck. You want to do this by taking 2 thick pieces of cloth or anything in this shape, placing it on either side of their head, and making sure that their nose is in line with their chin, is in line with their chest. This will help protect from spinal cord injury as you're transporting them. Now, with 2 people, with 1 person counting 1, 2, 3, we'll lift the patient off the ground with the stretcher. 1, 2, 3. And now your patient is ready for transport.
Congratulations! You have completed the trauma training course. You've learned how to stabilize a patient's ABCs and how to perform a secondary survey. All of this you've done and gotten your patient ready for transport to the hospital. Today you learned how to save a life. It's been a pleasure working with you, and we thank you for tuning in.